Hello, good afternoon.
Good afternoon.
Welcome to the Empowering New Nurses. Today I have an outstanding guest with me on the Empowering New Nurses show platform. So this afternoon, without any further ado, I'll dive right into it. We have shortages of nurses all over. We have new nurses. We have nurses studying for the NCLEX. We have new nurses going into different areas of nursing. Yeah, they are transitioning. And here this afternoon, I have a special guest. Can you just tell us a little about yourself, your name and special about yourself?
Sure. Thank you for having me, Dr. Smith. My name is Marcia Robinson. I'm a family and acute care nurse practitioner. I'm also a nurse educator in terms of university. So I work with students who are pursuing a master's or doctoral degree. And I also work currently in cardiology, heart failure, heart transplant, and coronary artery disease.
Great, that's great. So you have so much to offer in teaching and educating not just the nurses and the interprofessional team, but also the patients. Great.
Yes, that's true. That's true. I find that everything that you do, especially going to the years back when I was a medical assistant, plays into my current role. So it's everything is helpful and beneficial, not only to myself but also to the patient.
Exciting. So being a nurse is not your first career.
Well, my first major career.
Okay, okay, great, great. So as you look around you, you're seeing changes, so many changes. Any particular change that you've seen that you want to encourage, ensure that our nurses gain skills with, that you want to share and encourage our new nurses to participate in?
Well, I think one of the things that I want to just emphasize is that nursing is, again, it's not an easy profession, but it's a rewarding profession. And nurses have to have that balance between self-care in addition to taking care of the patients. And a lot of times as nurses, we overextend ourselves, we care for the patients long hours, and then we may do a lot of overtime. And that in the long run can lead to burnout and fatigue. So I think, I just wanted to reiterate to nurses that it's important to have that balance, just take time for ourselves as well as to care for our patients.
I love that. I truly do. Because as you mentioned before, that there are so many nurses who we do so much for our patients and we neglect our own selves. And it has been proven over and over, trying to help the other persons, doing advocating for the patient, but not advocating for yourselves or ourselves. I really truly appreciate that. And in my book, the book it has book is Nurse the guide to empower new nurses in the delivery of high quality care to all patients. This is so, so important, because when I include that, I've done it because as a educator for many years, I have on board many new nurses and also nurses who have had experience before, but they're transitioning to another area. And so they need that little extra help. They need that little extra embracing of the nuggets that are, you might not find them in the books, but from experience, you know what works. That's right. And we offer patient-centered care. So all the interprofessional team, everybody, psychologist, the doctor, the occupational therapist, the physical therapist, the social worker, and the list goes on. Yes. Right? Our ultimate goal is as we collaborate in our work is for that patient to resume optimal health, optimum health for that patient. It's all individualized. And at the same time, we offer culturally congruent care. By that I mean we customize our patients. They're from different cultures. They have certain norms and behavior. And so it's for us. It's for us to remind our young nurses that we don't treat everybody the same way, but we care for them as individuals.
You're absolutely right. I do find that a lot of times we run our plans of care as a lump for everyone. And so, we are now learning to discuss the plan of care with the patients, discuss whether they have special beliefs, family, social issues, so that you can tailor their plan of care to their lifestyle, to their family structure. And so, this is something that's very important, and I mentioned that I work in transplant before, and there are times when we've had to, let's say, deny a patient a transplant because they might not have good social support. Because when you are going through crisis, or when you need a transplant and you need medication follow-up, appointment follow-ups, frequent lab draws, you may be hospitalized multiple times before you actually get on the full path to recovery. You need a good social support system. So these are things that we take into account now. That not only is it just the patient themselves and them being in the hospital, but also everything else around them.
The family support, whoever gonna be there for that person at that time. It's so, so important. The medication, some of them might not understand, some of them might not be able to read and write. So who's there to back up? Who's there to help? So as an investigator at this time, you have to find the individuals who will be supportive to them during this time of crisis. Thank you so much. Thank you. So we're going with evidence-based care. And if you should elaborate a little bit on evidence-based, in my time, there were times when we would have done, and I'm talking more than 4 decades. Okay, so although I have made many adjustments along the path. Because there was a time, for example, when we used to be doing a dressing, an IV dressing every 3 days.
Yeah.
I remember that. The concept, it was, you have to do it so often. And yet, after, you would say, empirical study, research, have proven that it's not necessary for that. Of course, if it's soiled, you will do that immediately. But in terms of some of the procedures and the time frame, that many of those have changed.
Yeah.
So anything that you can recall that you might see any changes in as you educate your new nurse?
I have to speak from the perspective and advanced care nurse practitioner, because I work, again, because I work in cardiology, and I also have worked many years in primary care, and technology is evolving so quickly that now we have procedures and interventions for let's say, for example, valvular heart disease that we didn't have, just even 5 years ago. So now we have minimally invasive procedures that have been, of course, trialed throughout different study centers throughout the world, and they have proven benefit. And I experienced that firsthand, where we have patients with severe aortic stenosis, and we go in through the femoral artery and up into the aorta, and we're able to put a new valve in, again, without full open chest surgery. So, as time progresses, we're quickly seeing changes in the way we approach healthcare, so that patients can have their interventions, they can have their care, and their recovery time is better.
I love that. Thanks for sharing that, because I remember days when procedures were done and the patient would be hospitalized for many days. I mean, even take it for, let's say a procedure now, but say for even a baby, if there's a normal pregnancy and the mom goes into the hospital, might be another day, within a second day, maybe it will be longer. Of course, it'll be a little longer for C-section, but that time frame, being hospitalized, so much less. So thanks for advancement in the nursing and technology. And we're using so many technological devices now than we used to. For example, in the progress notes, we used to have to be writing and writing and writing and writing. Have you seen any improvement with that?
Oh, well, now I actually say we're typing and typing and typing. So, I mean, yes, we've transitioned from paper to computers, but documentation still does take up a good amount of your workday. So yes, you can still be very busy with the patient care, and it is important to document. But we have become faster in documenting because now you can dictate, or again, your notes are readable because it's computerized. So that has been One of the ups with technology is that, you know, it has allowed just about everybody's notes and recommendations to be readable or understandable or legible, versus when we were strictly on paper. And that has reduced the number of errors or confusions with patient medications or again, their plan of care, their discharges. So I do appreciate that end of technology.
Thank you. Thank you. I have observed that too. And we have seen, you know, some patients, I'm going to, on the backside of this, some patients would say, you know, I haven't seen my nurse for X minutes or so, because when they questioned that, the nurse was documenting. And you know, if it's not written, if it's not documented, it's not done. It's not done. And every nurse knows that. So therefore, we ensure that documentation is done. And remember, whatever you write today, what you've seen, is supposed to be written in such a way that you're not going to falsify anything, but you're also what? Taking care of you. You're taking care of the patient, you're taking care of yourself, and you document what you see. And there are, in maybe in another time when we talk, we'll talk about key things for documentation. Very important. So I just want to say thanks to you for coming on and sharing your expertise with our young nurses. I know we forever be grateful to you who have taken time out to share on this platform, empowering new nurses. Yes. We empower them. So before leaving, what were your final words? Before you actually go there, I must say something. What was COVID like for you? What was your what do you remember most out of this experience?
You know, I mean, COVID again is another, that was another experience that had both good and bad, because I mean, good in the sense that we learned together as, you know, as time went on, how to manage the patients, because again, when this first started, we weren't, this was not a disease that we knew much about. And so as time went on, we learned how to appropriately treat the patients, what medications to administer, you know, which patients to intubate, because again, you know, there were so many patients who were intubated in the early days of COVID. And we learned that not every patient needed to be intubated. They could require high flow, like high levels of high flow, and still make it through COVID. So, you know, and again, I work with so many, you streamline the care, because now you had specialists who didn't have office hours. They would take part in the critical care rounds. They would take care, let's say, when another patient needed central line. So we worked together as a team just to get the cure done in, you know, throughout COVID, because it was a difficult and challenging time for just about everyone.
Wow. Thank you so much, and thanks for serving that capacity during the COVID. We have lost many individuals. Right here now outside, if I look out to my left, we lost the guy who worked on my yard right there. We lost him. We lost his mom. We lost his sister, and I heard that brother and many family members. That's just two kids. So we have all been through it, one way or the other. I was working at the time as a nurse educator, and we had trailers on the outside. It was hard for all of us. And until now, we still have many recovering from the residue, and some residues have remained. And so we just want to say thanks to you all and all the survivors of it all. And there are so many stories. And thank you for sharing, because someone is encouraged today. And thank you for what you have done in that time. And let's not take it for granted. Do what you need to do. COVID has not been, I would say, out at all completely. So where necessary, you need to wear a glove, a mask. That's a glove, because you know that's different. But if you need to wear a mask in a very crowded area, or in areas where they require it, please adhere to the requirement. And so I do want to tell you thanks again for coming, and we really do appreciate you. Young nurses, you have heard the seasoned nurse and practitioner. Her words of encouragement to you, and may you just embrace them. In my book, Nurse, The Guide to Empowering New Nurses in the Delivery of High Quality Care, there are so many nuggets with communication. You might not find this in other books, right? However, I've put information for more than 4 decades in this book that can help you along your nursing journey. Thank you. Thank you for coming and thank you for participating and thank you for listening. Now, how can you connect with me? You can connect with me on YouTube and Miriam Amanda Smith. Also on podcast, Instagram, Spotify, Apple, and my website is Empowering New Nurses. Thank you so much. Now, don't forget to subscribe. Don't forget to make a comment. And if there's a topic that you would like us to discuss and talk about at 8 p.m. tomorrow evening, that's Monday evening, the 23rd, definitely you will be on live. So if you have something to contribute, please feel free to come on Instagram. I'll be there, 8 p.m. We'll be there, 8 p.m. Others will be there. We're watching now. Thank you, thank you, thank you. Be blessed.